Well, we're here with Joshua Ewing, the Health Programs Policy Specialist. So Josh, tell me more about your project this week.
Sure. So this week, NCSL hosted a half-day pre-conference titled Building a Lasting Healthcare System in Rural America. And in conjunction with that pre-conference, I put together a tutorial for our website on disparities that exist in rural America.
Great. Can you tell us what you mean by health disparities?
Sure. When we say health disparities, we're really looking at, for a specific population group, differences in the presence of disease, healthcare access, healthcare outcomes. For this tutorial, we were looking at the differences that exist between urban and rural areas.
And so can you give us an example of the disparities you found?
Yeah. For this, we found that rural people tend to be older. The population as a whole is a little bit older. They're less financially stable. They have poorer health overall than their urban counterparts. Rural people also tend to exhibit greater risk factors, so they're more likely to smoke, they're less active.
Interesting. What are some of the factors that contribute to these disparities?
So we found educational attainment, the poverty rate, the aging population. Anytime you're talking about health disparities, you have to look at insurance coverage and then access to healthcare services. Are there enough providers in those areas to give the care that's needed?
That sounds like a lot of information. Is there anything else you'd like to add?
Yeah, so this tutorial is really focused on the disparities that exist, but I would encourage anyone who's watching this at home to visit our other resources, because the news isn't all bad. This week we heard from experts from across the country who told us about efforts that are taking place in the states to really overcome distance in rural areas and really address rural health disparities. We heard about programs to recruit and retrain a healthcare workforce in rural America. We heard about advances in health information technology and the use of telehealth. And then we also heard about ways that existing resources are being utilized in a new way. So for instance, school-based health centers, or the use of community paramedicine, so using EMS services to deliver primary care. So the news isn't all bad, and this tutorial is focused on this tutorial is focused on the disparities that exist, but I would really encourage the viewers at home to visit our website or contact NCSL directly and learn more about efforts that are taking place in their states to really address rural health disparities.
Great, thank you.